Hello class, batch 24, year 4. Dr. Abiza here again to present dental manpower with emphasis on dental auxiliaries. The broad outline are manpower overview, classification and roles, and manpower in Malaysia. At the end of the presentations, students should be able to identify the various categories of dental auxiliaries, generalize at least 3 main duties and responsibilities of each auxiliary, and finally, able to differentiate between the roles of dentists and auxiliaries. Healthcare systems depend not only upon infrastructure and resources, but also on the availability of skilled human resources. The role of a dental team is essential to ensure provision of oral health services, which includes promotive, preventive, curative, and rehabilitative. Oral health services should be effective, efficient, appropriate, available, adequate, accessible, and equitable. What is a dentist? A dentist is a person licensed to practice dentistry under the law of the appropriate state, province, territory, or nation. A dentist is also known as a dental surgeon, is one who specializes in dentistry, the diagnosis, prevention, and treatment of diseases as well as conditions of the oral cavity. The dentist supporting team aids in providing oral health services. In UK, the supporting team is often known as dental auxiliary or ancillary. So what is known as a dental auxiliary? A dental auxiliary is a person who is given responsibility by a dentist so that he or she can help the dentist render dental care, but who is not himself or herself qualified with a dental degree. A dental auxiliary is any of the dentist supporting team who helps with dental treatment. They include dental assistants, known as dental nurses in the UK and Ireland, dental therapists, dental hygienists, and dental technologists. Their role is usually limited by regional dental regulations, which help define the boundaries of treatment that can be performed. In planning dental manpower, the three most common ways to develop models of dental personnel are need-based models, demand-based models, and dentist to population ratios. The ultimate choice of a model is based on either the availability of data to support the model or on the political or philosophical basis of those doing the evaluation. Referring to 2019 data of Malaysia, the dentist is to population ratio is 1 is to 3,017. The ratio for the dental auxiliaries is higher, but bearing in mind that the numbers are only from the MOH or the Ministry of Health, because the other non-MOH or private data is not available. There are 2,507 dental clinics. The total number of active dental practitioners in the year 2019 in Malaysia is about 10,801. The distribution in the private sector is largely based on demand and accessibility, with the highest being in the state of Selangor. The public sector is population-based manpower. In 2019, the local institution with the largest number of graduates who registered with the Malaysian Dental Council was the Penang International Dental College. So these are the list of institutions, public as well as private. So there are a total of 681 dental practitioners who registered in 2019 from the local institutions. Auxiliaries are grouped as non-operating and operating auxiliaries. The non-operating auxiliaries consist of the dental surgery assistant, dental secretary or receptionist, dental laboratory technician, and dental health educator, whereas the operating auxiliaries consist of the school dental nurse, dental therapist, dental hygienist, and the expanded function of dental auxiliaries. The biggest number of non-operating auxiliary is the dental surgery assistant, otherwise called DSA. The dental surgery assistant is a person who assists the dentist or dental hygienist with his or her clinical work, but does not independently carry out any procedures in the mouth. In some countries, they are referred to as dental nurse, and they are an invaluable part of the dental team. Hence, to enhance efficiency and productivity of the services, we have to have sound management, effective communication skill, and promotion of patient education. The functions are to ensure general smooth running of the clinical area, responsible in the management of instruments, equipments, and materials, including the cleansing, sterilizing, and recycling of these as necessary between patients. To supply instruments to the dentist at chairside as needed, but not legally permitted to do any procedures on patients. Has a duty to look after the general well-being of the patient. Some DSAs are also given patient reception and appointment making duties, as well as clerical work. We have what we call as a four-handed dentistry. A four-handed dentistry is an art of seating both the dentist and the dental assistant in such a way that both are within each easy reach of the patient's mouth. Perform additional tasks such as retraction or aspiration. Thus, the dentist can focus on working field more efficiently with less fatigue. The diagram shows the position of a four-handed dentistry for a right-handed dentist. And this is the position for a left-handed dentist. In a four-handed dentistry, the dentist and the DSA sit closely beside the supine patient. DSAs anticipating the instruments and materials that are required and passing them to the dentist in such a way that he may not have even to take his eyes momentarily away from the field of operation when changing to another instrument. The DSA must work in a close and coordinated manner with the dentist. The operating area must be well organized and contain equipment of suitable design. Another role of a dental receptionist or secretary for a non-operating auxiliary is to assist dentists with secretarial work and patient reception duties. They handle the patient crowd by guiding appointments after consulting the dentist. They should have a knowledge of materials used in the clinic and maintain the book of account keeping of all the bills. A dental lab technician is grouped as a non-operating auxiliary. The dental technician is a person who works in the lab constructing dental appliances to the prescription of the dentist. In Tasmania, Australia, lab technicians are legally permitted to work directly with the public to provide a prosthetic service. A dental lab technician may be employed by dentists in private or public health practice. They may be self-employed and accept work from dentists in the area. In Malaysia, they are known as dental technologists. An oral or dental educator has an important role within a dental practice to promote good oral health care and work with patients to prevent disease. Could also go out into their local communities and take their oral health messages to members of the public. Excellent communication skills is essential for this role to be effective and may be permitted to apply preventive agents intraorally. The school dental nurse. They compose of the operating auxiliary. The introduction of the dental nurse scheme or school children in Malaysia began in 1948. The school dental nurse was established in New Zealand in 1923 because of the high oral disease burden among school children. So in Malaysia, it is at a later date, which is about 25 years later. The functions include examination, diagnosis and treatment of the most prevalent oral diseases, preparation of cavities and teeth restoration, extraction of deciduous teeth, and doing scaling and tooth polishing. The school dental nurse also does topical fluoride application, provide dental health education, refers the more complex cases to dentists in the area, give local infiltration anesthesia but not block anesthesia. The dental therapist. This is a person who is permitted to carry out to the prescription of a supervising dentist certain specified preventive and treatment measures. They function as a clinical caries diagnosis, technique of cavity prep, material handling and restorative skill, vital pulpotomy, extraction of deciduous dentition, interpretation of X-rays, and also take radiographs. The dental hygienist was first employed in 1906 in a private dental practice in USA, and in 1913 the first formal training course for hygienists was established. Their functions include scaling and polishing of the teeth, topical application of fluoride, provision of dental health education. In some countries, dental hygienists are permitted to take radiographs, make impressions for study models, and polish restoration. There is another group of operating auxiliary known as frontier auxiliary. They existed in United States in frontier regions which are sparsely populated with social and economic barriers but in need of dental care. Nurses and former dental assistants can, in such areas, provide valuable services with minimum training before referring to the nearest dentist. They can perform simple dental prophylaxis, provide basic dental education, give advice on dental emergencies, and render dental first aid in cases with pain. There is what we call as an expanded function of a dental auxiliaries. So, for dental hygienists, there is an expanded function also for the dental assistant in doing their duty as a dental auxiliary. The functions include placing and removing rubber dams, placing and removing temporary restorations, placing and removing matrix bends, condensing and carving amalgam restoration in previously prepared teeth, placing of acrylic restoration in previously prepared teeth, applying the final finish and polish to previously listed restorations, fitting and removing of orthodontic bands, separating of teeth prior to bonding by dentists, and cementing temporary crowns. New auxiliary types. The Expert Committee on Auxiliary Dental Personnel of the WHO suggested two new types of dental auxiliaries. One is the dental licentiate and the other is a dental aide. The dental licentiate is a semi-independent operator. The functions include dental prophylaxis, cavity prep and fillings of primary and permanent teeth, extractions under LA, drainage of dental abscesses, early recognitions of more serious conditions. The duties include elementary first aid procedures for the relief of pain, extraction of teeth under local anesthesia, control of hemorrhage, and referral to the dentist. Degrees of supervision of dentists. Auxiliaries of all types operate under varying degrees of supervision by the dentist. In 1975, American Dental Association defined 4 degrees of supervision of auxiliaries with the assumption that ultimate responsibility was assumed by the dentist, licensed dentist. So the supervision can be divided as general, indirect, direct, and personal. General supervision is whereby the dentist has authorized the procedures and are being carried out in accordance with the diagnosis and treatment plan completed by the dentist. Dentists not required to be in the dental office when procedures are being performed. Has personally diagnosed condition to be treated. Has personally authorized the procedures and will evaluate the performance. In indirect supervision, the dentist is in the dental office, authorizes the procedure, and remains in the dental office while the procedures are being performed by the auxiliary. The dentist in the dental office has personally diagnosed the condition to be treated, authorizes and remains in the dental office, and the procedures are done by the auxiliaries and will be evaluated by the dentist. Direct supervision. Dentist is in the dental office, personally diagnoses the condition to be treated, personally authorizes the procedure, and before dismissal of patient, evaluates the performance of dental auxiliaries. In personal supervision, the dentist is personally operating on the patient and authorizes the auxiliary to aid treatment by concurrently performing supportive procedures. The dental manpower in Malaysia. We have three main groups, which is the dental therapists, dental technologists, and the dental surgery assistants. The training is conducted at the Dental Training College in Penang. The laws of Malaysia, Act 804, under the Dental Act of 2018, indicates that dental therapists may carry out following procedures under the fee schedule. Clinical procedures on persons below the age of 18 years. These include oral examination, class 1, 2, 3, and 5 restorations, administration of LA, extraction of primary teeth, placement of fissure sealant, application of fluoride gel and paste, supragingival scaling, and polishing. Dental therapists may also provide dental health promotion, education, and instruction. They were able to do intraoral photography, but by the instruction of the dental surgeon. And they can practice in the public sector, which is under the supervision of a dental surgeon in the public sector. In private sector, he or she must be under direct supervision of a dental surgeons at all times. The dental technologies. The nomenclature dental mechanics evolved to dental technicians in 1959 and to dental technologies in 1996 to reflect the change in the role of this category. They are responsible for designing and processing prosthetic, orthodontic, and maxillofacial appliances. They also do repair and maintenance of dental equipment. The dental technologies are regulated under the Allied Health Professionals Act 2016. The Dental Surgery Assistant, or the DSA, the 2-year certificate course of a DSA started as at the Dental Training School in Penang in 1982. Their role is to assist the dental officer or the dental nurse in management of patients, be responsible for infection control in the dental surgery, register patients, collect payments from patients, and issue receipts, and also to manage the patient's records. For dental manpower in Malaysia, the key questions we need to be considered are: what impact will the dental therapists employed in school-based programs have on reducing access disparities? Number 2, should the dental technologies in Malaysia be regulated under the Dental Act of 2018? Number 3, outline the rationale for training of dental auxiliaries and the impact on the dental delivery care system. Number 4, relate future roles of dental therapists in Ministry of Health with the influx of dental officers in recent years. In conclusion, dental auxiliaries have the responsibilities of providing a high standard of service to their patients, and they should assume their duties freely and voluntarily. Effective use of allied dental personnel increases output per dentist and net incomes. By employing dental auxiliaries, we will increase the capacity to see more patients. These are the references for the presentation. And for the Malaysian data, you refer to the laws of Malaysia Act 804, otherwise known as the Dental Act 2018, the Malaysian Dental Council, and Ministry of Health Facts 2020, which give the data for 2019, and also the milestones in dentistry. You can access all these from the website of the Ministry of Health. And with that, I thank you for your kind listening and wish best of luck to the batch 24 year 4. See you soon. Bye.